Oh, you didn't think I was going to get that one, did you?
Whoa.
Ooh. There we go.
That was loud.
Oh, breathe, breathe. Come on, come on.
Promise I'm not going to drop a tear.
Crunch.
Oh my god. Feels so much better.
Good job.
The spinal column is where the nerves that go to your shoulder come from. And when we feel things in our shoulder, it's like hitting your funny bone, you feel it here.
Yes,
if you hit the nerve in your lower neck, you're going to feel it in your shoulder. And so it's unfortunate that they went and had a shoulder MRI when really we should have had a neck MRI, where more likely at the younger ages we have disc injury is so prevalent because of not only your job, where you've been a bartender for how many years?
Since I'm 17 now, I'm 31, so...
Right, so a lot of years of where you're essentially stuck bending forward, or you're forward or you're down and you're not doing anything to counter stretch, and that puts a lot of pressure on these discs on the front. So the cartilage on our spine, or these little spacers here, they're made of water and they have no feeling, and when we're bent forward, the weight shifts off the joint, which is these little knuckles back here. That's where the vertebrae connect with each other, and then the weight shifts onto the disc on the front. And this disc eventually dehydrates, and if this model shows a disc injury here at the bottom where the disc we have so much compression on the front that the material starts to shift towards the back, and then you start getting involvement with the nerve, where the disc hits the nerve, and then in your case obviously it's here in the lower neck. But the same principle of the disc injury occupying space that shouldn't be occupied, the nerve getting hit, and then you feel it in your... Now when you're at the gym lifting weights, you're then obviously loading the joint, loading the disc, and more compression. That disc bulges out another millimeter. You're then actively moving the joint around while you're, so that space is getting narrowed, you're hitting the nerve, then you're getting that shoulder pain. So, I'm glad that they at least ruled out the shoulder. Okay, there's no labral tears or rotator cuff tears, and we took that out. So we now are left with the more common things, which is actually disc injury, is actually more common than even shoulder issues. I would say that especially because of the posture you're in even before you became a bartender. So go back to like when you were a kid in school, so we take a posture of we're sitting a dozen hours of the day, and then we go out into life and work, and we're still bent forward, and we should have been guided even at an elementary age and a teenager age when the spine was soft. So think of it like clay. Our spine is malleable when we're young, up to about 26, and at 26, the cement hardens. And then whatever position you're in, that's kind of where your body wants to be. Lower neck controls your shoulder blade, shoulder, whole arm.
All the nerves, yeah.
All the nerves going down.
Even sometimes when I'm working out and I'm warming up, when I press over here and try to, rotate my elbow, I can feel the tingle over here.
Correct.
Yeah, in the end.
So a simple kind of principle is that whenever tilting my head to the right or lifting my right shoulder up is the same thing. The holes on the side that you're lifting your arm up to or tilting your head, so I'm going to use these ones because they're a little bit bigger, but when I tilt to that side, the holes get smaller. If I tilt away, see how it gets bigger?
Yeah.
Right, so, Ed, I lift my arm up, okay, that's like tilting your head to the side, and then you move, and then that hole is changing in size, and you're whacking the nerve, and then that nerve ultimately goes down.
That's why I thought it might be some problem with the rotator cuff, but they say that there's nothing to do with that.
Yeah.
So, and with my lower back is pretty similar. That is 3.5 years ago. I was squatting, and on one of the reps, I was just like electricity went through my whole body, and I just couldn't move for 2 days probably. Yeah, and ever since, whenever I'm just trying to bend forward or on the side, and just there is something that I have the feeling that every second something's gonna snap over there.
Yeah. Right. Well, we had ultimately. See, I know most doctors ask the question, why is that area injured? I ask an opposite question: why are you not injured in these other areas? And if we can understand why other areas aren't injured, we can start to understand why that area got injured when you did that activity. Most of the mechanical stress was in one spot. So when you were doing a squat or doing an exercise, you didn't have your whole team working, and then all the force mechanically went into one area. the nerve got hit, the joint got irritated. Did you feel that go down your leg, or did it stay in the back?
Not really. If I because I used to play volleyball,
Yeah.
and every now and then I play it. If we play for like 2-3 hours after that, there was a little like tingling.
In the thigh?
Yes,
Yeah.
just over here, but
Yeah.
it's like rare, like
Okay.
super rare.
Oh, yeah.
While I'm standing
You're
right
fine,
now,
use your legs.
I can
Yeah.
feel the tension over
Yes, sir.
here.
Yeah. So we have your head's 2 inches forward. From the center of your shoulder, from the side to the ear hole in the side, we're dealing with a couple inch forward head posture. And again, your work requires this. You know, it doesn't surprise me, but the alignment that you're in keeps a constant stress on this area. As if you were, say, holding a bowling ball in front of you, your muscles work harder than if it's close to you. So the head is like a weight that the more forward it goes, it torques and stresses this area. So there's 2 facets of your care. One, getting your spine clean and limber, getting all the parts of your back moving properly. And then at the end of our visit, we want to try to aim your spine. We have these, well, neck dental. They're pieces of foam, they're orthotics that mold the arch back to your spine and help bring the head back to the not only to reduce the forward head posture, but also to bring the arch or curve back to your spine. Not only does the head go forward, but the curve in the neck goes straight. And so like a ladder, all the weight transitions right down to the lower neck. So we want to do 2 things: loosen the upper neck, get the curve back in the neck, and then bring the head back. Yeah, the torso. Give me 1 second. Yeah. All right. Yeah, your body's, what happens is when we have an injury like that to our spine, your body will kind of, you know, transition and try to lean away from the area that hurts.
Yeah.
So then your body sort of becomes,
And try to compensate.
it compensates, and then that becomes your new, and then this is why people will say, well, yeah, I had pain over here, and then a year later it hurt over here. Your body's trying to, and that isn't the problem. That's an expected kind of good thing, but ultimately we need the whole spine working so we don't keep compensating and then run out of places to compensate to. All right. Pain when you do that?
No.
Turn your head right. A lot farther that way.
Really?
So yeah, you.
But there is a pain over here.
And then pain on the
tension,
right.
yeah.
And then go ahead and look up for me. All right. Any pain when you look up?
No.
Okay. And then look down. Okay. All right. Yeah, your neck is used that way.
Yeah.
Okay, scoot down a little bit for me.
All right.
Scoot down. There we go. All right. Take 1 deep breath in for me. A little sit up. Head back for me. Let all the air out. Keep exhaling. It's okay. Deep breath in for me. Very nice. Exhale. Let it go. I got you, buddy. Okay. Here we go. Deep breath in. Okay. Deep breath. Let it go. I got you. Exhale. Let it go. Chin down a little bit. Chin down. There we go. Wow. Got it. Everything is pushed out to the right here.
Mm-hmm.
Yeah, everything is. Your head is tilted left. That's why you're pinching the left shoulder. There's an injury, or actually an inability for your head to tilt to the right.
Okay.
Does that make sense? Your neck doesn't like this, and so essentially you're in left lateral bending all the time. And so those, like I showed you, when you tilt the spine, the holes get smaller. Yeah. And then when you add lifting your arm up, because essentially you're already tilted left, now that hole's getting real small. And then there's already probably some aging of the discs in the lower neck that's making it easier for that nerve to get hit. There we go. There we go. Right here. We call it antalgia. Anta means away from, algia means pain. Mm-hmm. Your body will naturally kind of avoid areas that are hurting and find a new position of comfort away from those areas. And so essentially, because there's an injury on the right side of your neck, that your body's first way of dealing with it was just we'll just move the weight to the other side, and try to avoid it. And now the left side is what we call the compensatory pain. The right side's the kind of source, mm-hmm. and then the left is the effect.
Before that, they were telling me that the problem is on the left side.
Correct. No, the problem's on the right. It's okay. The avoidance of your right is the problem. There we go. I got you. Good. I got you. Mm-hmm. Just let this go. Yeah. I know. You all right?
Yeah.
No, that's a tough one. That's the hardest one.
Yeah.
I went right for the hardest guy. The tightest vertebrae is that vertebrae right there. It's okay. Relax.
Ooh.
There we go.
That was loud.
You're good. All right. There you go.
This side doesn't seem too bad.
Mm-hmm. The abused side already is used to moving around.
Mm-hmm.
It's not. It's the tight, frozen side that's the most,
Mm-hmm.
let's say, upset with me going in here. I'll try to push that rib down there. Oh,
That's the problem.
mm-hmm.
Everything starts from this one.
Yep. They're just the roots of the neck. So think of a tree
Yeah.
leaning over on the opposite side. The roots start to come out of the ground, right? And you can push the roots back down, but if the tree keeps on leaning over, it's kind of silly. We have to get the tree upright, and then you won't have to worry about the roots elevating. It's I feel like a lot of doctors, therapists get lost in Symptomville in trying to treat a trigger point. It's like,
Yeah.
well, there's trigger points. Yeah, there's trigger points because his head's forward. And if we don't reduce the forward head posture, the trigger points will never go away. You'll be treating trigger points the rest of your relationship with the patient. So what people ask me, what do you think about trigger points? The answer is trigger points shouldn't exist. Trigger
Okay.
points exist because of, one, either bad posture, your head's forward, or two, injury and guarding. So your body will tighten up a muscle to protect an area. In both situations, we need to get to the source of why it's happening and either take the stress off the area that's injured, that's being protected, or change the posture.
Oh, I'm just trying to massage it because after a workout, it's just like so much tension on it.
Yeah.
This particular point.
Yes. There you go. Right where I'm rubbing, there's a good size. We call the Shaw is the mark. When you comb the tissue,
Yeah.
nothing really should happen. It should just become kind of maybe pinkish or flushed looking. But when we get a darker reddening, it means that something inside has been trapped. Lactic acid, what was originally termed a Shaw,
Yeah.
but it's right up here. Is that this is really the cause of the left side? Is this not, however you want to describe that crunchiness and
Yeah.
it's like the first pass with a vacuum cleaner.
Yeah, it's
You know?
true.
The vacuum's like,
Yeah.
oh, jeez, what'd you dump in this carpet? I don't know. I had a big party last night.
Yeah.
Who knows what God put in here. Just hold that to the. So when we're on the piece of foam at the end, we're going to actually have you with your head back, and we'll do a little bit of right bending to push more on this right side for, I don't know, maybe a dozen times or maybe a month or so. We'll have you when you're on it. We're going to actually get a little extra pressure on the right to level it, and then eventually your care will just be straight in the middle.
Okay.
But it'll be a little off kilter for a while as I try to. It's like a drawer. The drawer is tilted in. One side of the drawer is more pushed in.
Yeah.
So I want more pressure on the side that's farther out to get the drawer level, and then we just take the drawer evenly in. But we're crooked here. We gotta get this right side.
I guess that's been tilting for a very long time. So.
It's okay. See if we can get a little bit more here. It's okay. I got you. Everybody walks out. There you go. Everybody walks out. There you go. There you go. Notice the sound difference,
Yeah.
right? You notice
It's not so deep and.
Yeah. It wasn't clunk. First of all, it was the same bone moving, but a little bit deeper. You understand?
Okay. Yeah,
What
yeah.
we're trying to do is we got to get the weight back on the knuckles so that we can stretch. When I put you on this piece of foam, if the joints are swollen, you actually can't bring your head back deep enough to stretch this ligament, right? So our posture is defined by rubber bands that wrap our spine. The ligaments on the back have been stretched out for years.
Yeah.
And they don't have the elasticity to pull us back up. And so then people get lost in this, well, we got to strengthen your back muscles to pull you up. And I say, good luck with that, because muscles get tired and fatigued and fill up with lactic acid. And there is a whole large group of people teaching core strengthening and strengthen your rhomboids. And I just go, have fun. I'm not interested in teaching that. I'm interested in loosening the front so that your body will be upright, not needing contracted muscles to be upright. And so to do that effectively, we have to make the knuckles in your spine compressible, so they'll come together like a handshake.
Mm-hmm.
Like right in here. That's special.
That's the one. In the beginning it was weird for me because the knot is on the back under my scapula and the pain was going to my shoulder and after that my pecs. I'm like, what is happening?
What the heck's going on here?
Yeah. And of course it's going up to my neck too. Sometimes I have a terrible headache after a workout.
Yes, sir. Yeah, the trap attaches here, attaches up there in the upper neck. They're all the attachment points are going to be upset. Kind of goes without saying that there'd be some tendonitis if you're lifting weights and doing overhead presses and incline presses and whatever, that there's going to be some inflammation. It's like, there's some plaque on your teeth. Oh, really? No way. I haven't brushed in a year. No way. There's some plaque on my teeth? Really, doctor? How'd you find that out? There we go.
Throughout those couple of years that my shoulder's been bothering, I'm just trying to find what's the problem, what's the cause of it. And sometimes I tend to sleep with my my arm underneath the pillow. So I'm like
on your belly?
No.
On your back, above your head like that.
Yes, yeah. So I was like, Jesus.
Yeah, let's not do that.
No.
So essentially that rib is elevated. You have a couple things, like essentially your head's tilted to the side all night long and the rib is elevated.
Yeah.
You're stretching into the humpback position. That's what essentially you're doing. Your posture is defined by whatever position you're in for the most amount of time is where your body wants to be, right? So a question might be, well, Dr. Ed, you want me to stretch backwards for 20 minutes. How in the world can stretching backwards for 20 minutes have any hope of balancing the 6 hour, 8 hour, however long we bartend? And the answer is because when I bend you back, I want you to be bent back as far as we can safely bend back.
Okay.
And hopefully when you're bartending, you're not as far forward as you possibly could be bent forward.
Yeah.
You understand? You're mildly bent forward. You're not as deeply bent forward as doing a deep forward bending. And so extreme extension can balance mild flexion.
Okay.
So when the nerves in the neck are upset for a long time, the shoulder will dysfunction. It will become a shoulder problem. This is where, again, chiropractors, practitioners get confused because, no, Dr. Ed, he does have subacromial bursitis, or he does have a tendonitis. And it's like, well, yes, because the nerve in his neck has been upset for so long, the nerve in the neck actually controls the health of your shoulder. So when the nerve is upset from a disc, from pressure in the lower neck, from injury, it causes shoulder dysfunction. And so I feel like people get trapped in that, like just focusing on the shoulder because that's where the symptoms are, and they're still not getting to the source, which is the neck involvement. How many years have you been going to the gym? How many years have you been doing like that? Or at least, let's say, actively going to the gym?
8.
8 years.
Okay. Yeah.
So this is some of this. Some of this is just build up from the gym. You know,
for sure.
This is not
over the years, injuries.
Right. It's just build up. I think of it. My favorite is our body controls. Your brain controls muscles through controlled electrocution. That's actually controlled tasering. Essentially, is how you move your arm. There's that wire. Conducts electricity, and when that electricity when the muscle receives that electricity, it contracts.
Yeah.
In a very controlled environment. This is why a taser gun works. This is why you can be shot with a taser gun, and the electricity, these two prongs, does that make sense? Create a circuit, and your muscles listen to that electricity, thinking it's the electricity coming from your brain. They don't discern or ask questions. Hey guys, do you think this electricity came from the brain? They just say, hey, we're getting hit with electricity, and they make cool YouTube videos of people falling over, getting hit with electricity. My point is that muscles will stay contracted if the electricity that's causing them to contract doesn't stop.
Oh, okay.
Right? You can trigger point, push, rub. You can do lasers. Does that make sense? Any stretching, it won't work if we don't stop the thing that's causing the contraction. We're just goofing around.
The main problem.
Right.
Yeah.
So, yes, once the tasering from the spinal column has stopped, you sometimes do need to go in there and release the contraction. And so you'll see me, well, Dr. Eddie, I thought you said you just have to work on the spine. No, sometimes after you've done the spinal work, now you're allowed to go into the shoulder and release what's stuck. But only after you've stopped the thing that caused it to be stuck in the first place.
Sometimes I'm getting twitches over there. So it's just like...
Okay.
I was about to say the right side could handle a lot, but...
Both sides are...
Yeah.
Epsom salt will be required today. I would love if you can, at the very least, soak in a tub, 15, 20 minutes, just warm, comfortable water, soak minimal water if possible, salt on your back, salt in the tub. You can make a salt compress. You could take a cup with water, put some salt in it, scoop the salt out and rub it specifically on the areas, then cover it with like a salty towel, you understand, and just cover the area like a salt compress.
Okay.
But, or you can He-Man it and
Yeah.
drink a lot of water and just don't be upset with me tomorrow morning when you're sore.
It's all right.
Okay, fair enough. Okay, and when you hurt your back, was it on the right side? What side would you say that was on?
I think it was
On the left?
mostly like a left one.
Okay, so you're still in the original injury. My point
Yeah.
is, so when I see your back, the left side is elevated,
Uh-huh.
and so you're in left avoidance. Yeah. I joke, if you want a quiet visit, it costs double. If you let me talk, it's discounted. Okay. Be a lot. Dr. Ed, it'd be a lot more soothing and calm if you just be quiet. In that sense, it costs extra. Anyway, there we go. All right. Yeah, just bringing this back online. So when you move your arms around, I want to say in precise movements, you have to lock your chest so you don't have your arms moving erratically, right?
Yeah.
So your work and even gym exercises encourage chest rigidity, and so it makes you a good weightlifter, it makes you a good bartender. But in terms of allowing your spine to last long, we need to have some balance of strength and flexibility, and bringing you closer to flexibility away from the power stiff side, because ultimately our spine, we want it to last 90 or 100 years or however long. We're not going to make it if it's all rigid. So it's just a balance. This is what happened when you were a teenager. Something happened, soccer, who knows, something, high school injury.
Yeah.
Right in here. This side is not nearly as misaligned, and the biggest misalignment is right.
I have the feeling that the left side is like 2 inches elevated.
It is.
The right
Well, that's why. That's why I asked about the right lower, because this eventually causes this, and the end game will be this will wear. I hate them. Without me in your life, this would be where surgery happens. Do you understand?
yeah,
the
yeah.
the right lower part of your back would age at a much faster rate, and so the first place that you would get to where they're going to operate would be your right lower. It wouldn't be the left side. It would be the right lower, and the cause would be this up here on the left middle. Throws the work to the right side. And the biggest mark's going to be right here. This is where the most internal blockage
Good now.
is all trapped in here. Right there. That's the ground zero.
Jeez.
Right there. Yeah, it's pretty obvious. There we go. There we go. Oh, right there.
Jeez.
Oh, I know, yeah. Right there. Oh, breathe, breathe. Come on, come on. Mm-hmm.
Promise I'm not gonna drop a tear. Right,
Yes,
this
sir.
one.
Yeah,
Jeez.
yeah. Yeah,
That's the one.
yeah.
Jeez.
Yes, yes. Eventually, this all becomes easy. The goal is to get to a place where, Ed, is that all you got? Yeah, there's no normal soreness. There's no normal tenderness in your back. And that's the place we try to bring my black belt patients, the people that mastered everything I give them. You know, they come in here and they're laughing at me as I'm sweating, as I'm tearing up. They're, taking it easy, and that's the place we try to get people to. Crunch. There it is, yeah. Yeah, just released a little bit. There we go.
Gee.
There's ground zero right Oh, right there. Here we go. Oh, yes.
Where's the nut over there? Is it gone?
Mm-hmm. Right there. Push it back down on its attachment right there.
Uh-huh.
That's where it attaches
Oh.
on. There we go.
I thought just the left side is inflamed, but the right side isn't as much.
Mm-hmm. There it is, nice. Ooh, yes.
Thank God I'm facing down, nobody could see the tears.
Yeah, that was the original injury finally letting loose there. Oh, nice. That was right over ground zero here. That's what caused that lower back lightning. Was ultimately this guy being locked, and then you did a lift, and then your lower back just did extra because this was on the sidelines observing and watching and not being a part of the team. Breathe, exhale. Oh, you didn't think I was going to get that one, did you? He was, oh, yes. Okay, good. 1 second. Breathe. Good. Other side for me. Good. Very nice. I got you. Wow. Those haven't moved in forever. Jeez. I mean, I just basically sat on them and they didn't move. There you go. All right. The fact that it takes that much to get it to move means it hasn't been working for you until now. You know, if it takes me like...
Like a new person.
You look like you went to war.
Yeah, really.
You look at your shoulders and all.
Your back is crazy.
Will, it's your turn.
This is
Oh my god.
all purple down here. That's right there.
That's
is
old
where-
injuries.
That's where he is.
So is
the shoulder and then
Oh my god.
and obviously the front part of the shoulder is.
Seems pretty. Looks pretty.
You know, the pec. Like I said, you're an athlete. You gotta, this is part of this like just regular plaque buildup for being an athlete, and then the stuff on the backside. The biggest concern to me is this guy here.
Mm-hmm.
That guy there, and obviously this channel here being pinched. These two spots need to be, these are the sources. These are all effects. A lot of these are effects, but if you clear this guy, this would never build up like this. This happened as a result of this being here for a decade, and then the shoulder starts to, build up all this lactic acid, but it's ultimately the spinal health that controls it at the source.
Mm-hmm.
Okay. Just gonna do this.
Look at this.
Look up for me a little bit. Just look up a little bit. Now press back with your elbow into my elbow. Press back. There you go.
Ooh.
All right, press back. Press back a little bit more. Here, a little bit. Okay, good. Let me check your ear. Do some fun stuff.
Yeah.
What are you doing to him? Leave his ear on. I like his ear. All right, I'll leave him. Go ahead and tilt left. There we go. Yeah.
Ooh.
Go ahead and tilt to the left.
Oh my god. Not even possible.
Go ahead and tilt right. Tilt right. Go ahead and tilt right. Okay. Lean back a little bit. Okay, relax. There you go. There you go. Just checking all that. Hard-working people. That's right. You don't need to ever twist or just straight traction. Just straight traction. Yeah, just trying to get some blood flow in here. You don't have to go like that or do all the just straight traction and get some. The blood flow is really what the lubricant for our joints is. It comes from the blood. So yes. Okay. I got you. There we go. All right. Just relax. Relax. There you go. Yeah, there we go. There we go. Not today. Okay. I got your ankle. Breathe. Relax. Oh. Ooh. Okay.
Whoa.
Almost like a triple crunch. That was quite a bit there. Okay, it's still on.
Yeah.
All right, good.
Usually when I'm just trying to get up and I can feel the pain
Yeah.
over my lower back, there's nothing now.
Yeah, cool. Just real quick, if you just turn your neck in, I'm just going to check that again one more time. So just go ahead and turn your head right, turn left, turn towards
Left
left. Turn it left. Yeah, better. Look right. Yeah, not moving your chest anymore.
Yeah.
Look up for me. Look up for me. Yeah. Wow. Another inch. Head comes back. Yeah, you should be, your neck size should be on the large one. What's happened is, I have you on one a little bit not as tall as this, and the reason I have that is because your neck needs to be bending more, and if it's, like your head should be on the ground back here. Does that make sense?
Okay.
Yeah, but your neck is resistant to curving. And maybe in 6 months you'd be ready for the bigger guy, but for now, I would start you with this guy. I don't want your head being pushed too far forward. I want the neck curving over it. That makes sense? Sometimes you'll take your hand, you place it on your forehead,
Just press
and you press to try to get it. It's got to start accepting mold. His neck wants to be straight. Do you understand?
Yeah.
And I want it to be
Oh, wow.
curved, and your neck's like, I don't think so.
Not yet.
Who do you think you are? And so, and like I said, I mentioned earlier, you can do a little bit of right bend. That makes sense?
Yeah.
Just a little bit of maybe 5 or 10 degrees. You just tilt to get a little extra pressure on that right side. And one way you could make this easier is you lay on the floor next to the TV, and say if the TV was right here, you could kind of have your head just turn to the right a little bit to angulate to that, so you can watch TV or whatever, and that would be the way you get more pressure on the right.
Okay.
I do that for about a month, because it will change. It will level out, and then long term, the prescription would be just have your head straight on it. I have a book behind your head to reduce the depth, and I'm going to take it out in a second. So why don't you get used, I understand I'm introducing a new thing to your spine, right? It's like I'm putting on a bicycle and saying ride, and you've never ridden a bicycle before and you're gonna crash, and this is impossible. I don't know how anybody can ride a bicycle. These are new things, okay? So we have to get used to, it's the opposite of what bartending does.
Yeah.
Right? We're taking you to the opposite position. If you start feeling anything in your lower back or down the leg, I understand if the lower back might be in pain before you get on it. I don't want anything in the lower back or leg getting worse. I want it. What I want is it to feel uncomfortable where it's pressing in.
No, it's fine. Yeah.
Hang in there.
Yeah.
We need to, push through that. The middle back needs to be loosened up, and the middle back loosening up is going to be sore. It's going to. Ed, I got off the Denerol. My middle back was really upset.
You did great.
You're great.
Thank you very much.
Good.
Thank you,
Thank
though.
Appreciate it.
Oh my God. Feels so much better.
Good job.
Yeah.